Welcome to Skinside Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to Skinside Out, where science meets beauty. I'm your host, Dr. Zain, with Courtney and Heather. So today we're going to be continuing our discussion of hair loss, but now focusing on treatments.
First, understanding hair loss. I think hair loss is very complicated. If you haven't watched our last episode, go and watch that first because that'll give you a deep dive into the different types. There's androgenetic alopecia, traction alopecia, any scarring alopecias. So they're all different causes. And so I think that makes a big difference in the treatments.
Yeah, so we'll talk about different treatment options, whether that's topicals, oral medications, as well as in-office procedures you can do and at-home supplements you can help take to adjunct a lot of these procedures. So go ahead and get into it with the topical treatments. I think the most common treatment that everyone is familiar with is Minoxidil, otherwise known as Rogaine over the counter. So Minoxidil helps to stimulate hair growth and it can slow down that hair loss, but it is something that we do see takes time. So it does come over the counter. Like I said, you can get the generic or the name brand Rogaine. One thing to look out for is that they do have hair Rogaine for men and for women. And so for the woman, they give us a 2% instead of a 5%. And the other thing you really want to be mindful with a topical Minoxidil is that you are washing your hands after you apply it, because if you are touching your face or other parts of the body, that solution can create hair growth in those areas. So
I think Rogaine has actually caught on board now because I had a patient the other day who brought her box of Rogaine and it said Rogaine for women and it was actually a 5% now.
Oh,
so
good.
I think we complained too much.
I know, it was a little biased, I felt.
You know, there was something interesting a few years ago. It's called the pink tax, right?
Yeah,
like
yeah.
for women, like actually a lower strength percentage, the 2% was more expensive than the men's, which I found
crazy.
mind-boggling, but it is unfortunately a reality. But hopefully, you know, things are changing.
Yeah, and I don't know if they worry about women having it drip down their face or things like that, but I always tell patients if they're using it to make sure that they're tilting their head back, especially women, tilting their head back and then, like I said, washing their hands after, because I have had that phone call from a patient before, stressed that she was having hair all over her forehead and down like on her sideburn area, and she went immediately to get it waxed, and after that she definitely learned how to apply it a little bit more evenly.
Yeah, and you can get compounded versions of the medication as a prescription at higher percentages. So they have shown to be helpful. So if you see your dermatologist and you want to try, you know, higher strength Minoxidil, that is possible. I mean, I've seen 7%, 8% Minoxidil, and that could be helpful.
Yeah, and to speak to that, there are compounded versions of the Minoxidil like we sell in our office, and these are actually compounded with, it can be progesterone for our female patients, or it can also be compounded with finasteride for our male patients. So that is nice because you get a little bit of benefit from both medications, compounded into just one, and you apply it twice a day, you're good to go.
And it's very convenient that way. And we say twice a day. In reality, do many of our patients use it twice a day?
No.
We're lucky if we get it once a day.
Yeah.
So if they can get the benefits from that, even with like a single application, because we do see results even with once a day, because some patients, just with the texture, how it dries, styling their hair, etc., and also life. I mean, patients say that, you know, they don't have enough time, and I get it.
Yeah.
They're busy.
Yeah, there are other products as well. We're, exploring growth factors every day now, and those have been shown to have great benefits as far as regrowing that hair. So we use Care Factor in our office. They have a wonderful shampoo, conditioner that they sell, as well as a scalp solution. It's actually activated by red light, which can help also influence more growth factors and get a better efficacy out of the medication. But it's a really interesting realm to be in right now, as far as, medications for hair loss.
Yeah, there's also topical JAK inhibitors, which are used for a lot of different things, but we are starting to see some really good effects for hair loss. The biggest thing with JAK inhibitors right now are getting insurance on board, I guess, is the biggest one. So we have used a lot of topical JAK inhibitors are pretty much this class of medications that inhibit the JAK pathway. And that can contribute to numerous things. There's like eczema, hair loss, vitiligo. So there are a lot of different conditions that JAK inhibitors can treat, but we are definitely starting to see it help with some types of alopecia.
Yeah, and the JAK inhibitors are especially helpful for alopecia areata, which is an autoimmune condition. So that's where we've seen the most promise with it.
Yeah. Next, we'll kind of get into the oral medications. A lot of these are actually very similar to some of the topical regimens, but more prescription based for, I guess, for most of them. But we'll start out with minoxidil. So like Courtney mentioned, topical minoxidil can be over the counter, but it's also prescription. Oral minoxidil is just a prescription. So it's actually a blood pressure medication. It doesn't do a great job at treating blood pressure, but technically it could lower your blood pressure. But the nice thing about minoxidil for hair loss is we're using it at such a low dose, so it's not really making a huge difference. But I would say if you do have really low blood pressure, it might be worth, being cautious about that one. But really what minoxidil does is it actually vasodilates your blood vessels to help bring nutrients and antioxidants, vitamins and minerals to your scalp, to your hair follicles to help stimulate that hair growth. It also prolongs the growth phase in general, so you have more of that growth coming in. Next is finasteride, so that comes in a pill as well. Brand name is Propecia. You might have heard of it. And this works very differently. It actually blocks DHT. So to kind of explain that, the difference between minoxidil and finasteride, minoxidil really helps to stimulate hair growth. Finasteride is really good about keeping the hair that you have. So some people, especially women, don't really like the feeling of taking minoxidil because it could stimulate hair growth in other places. Finasteride we typically only use for men because of that blockage of DHT. It's not something that we do, especially in childbearing age women.
Yeah, but postmenopausal women, we do use finasteride and even dutasteride. Yeah. And then spironolactone has been shown to be very helpful for women with, female pattern hair loss. Like we had talked about in our last episode, female pattern hair loss and male pattern hair loss has a hormonal influence. And what spironolactone does is helps to block the effects of male androgens or male hormones from binding onto those receptors on the hair follicles that are have been shown to lead to premature shedding in this condition. So it helps to almost protect those hair follicles.
I love spironolactone. I think it helps with acne. It helps with hair growth on the scalp, but especially for women who get hair growth in other places that they don't want it, it helps control that too. So it has phenomenal results, and it takes a little bit of time, but it works really great.
If only we can use it in men.
Yeah.
You get other side effects.
You can get breast swelling.
Well, and that one started as a blood pressure medication as well. So it's just funny that all of they still use it, but it's funny that all of these medicines started with other purposes. And
yeah, you definitely have to be really good about hydrating yourself on spironolactone because it's a diuretic, and that's how it actually helps with blood pressure too. But if you're not hydrating yourself, you could get dizzy and have headaches.
Let's talk about supplements and nutraceuticals. So this is often a hot topic. So first and foremost, I know everyone talks about biotin for hair loss. Biotin is exactly. I'm not a fan. First of all, I've been treating hair loss for over a decade. I have not found one patient who has told me, "Oh my God, biotin has changed my hair loss.
Yeah.
I regrew all my hair back. It stopped the shedding and everything." Like everyone's like, it does nothing. That's
Where
been my
did
clinical
the
response.
propaganda on biotin come from?
Yeah,
Who
it's amazing.
started?
I have no idea. But honestly, like, don't waste your money. Don't buy the biotin supplements. They don't work. And in fact, we routinely do not recommend it because it can interfere with thyroid and cardiac tests. So like when you're in the hospital or you're having labs done, we don't want that influencing your results. and making it hard for us to interpret those. I'm just not a biotin fan. It can sometimes lead to acne.
Unless you're deficient, then, it might be worth it. But
And it's very hard to be deficient.
yeah, exactly.
It's very hard. Like you have to be like, starving and, be vegan and just like have a lot of malnutrition. And you would see those signs of that. And you probably have telogen hair loss from that too.
Yeah.
No to biotin.
Yeah.
Now there are other very popular commercial, supplements for hair loss out there. You probably have heard of them: Nutrafol, Viviscal. Do they work? The jury's out. But I really haven't seen many results from patients who've been on them.
Nutrafol's expensive too.
Very expensive.
You have to take 4.
And they're huge. They're like
yeah.
horse pills.
Yeah, I literally, and I think you have to take 4 a day if I'm not mistaken. And I'll never forget the first time I ever took Nutrafol, I was only able to actually swallow 2 of them because they're so big. I mean, you're literally like swallowing like a whole glass of water with each one.
I had a patient who choked on one.
Yeah, I believe it. I almost did. And I was at the car dealership. I was getting my car fixed and I was like so nauseous. I didn't eat that morning, but I just was like, oh, let me take my Nutrafol. It's first day. And I was like, I will never take this again.
No, and I'm sorry. Like, I know that they have all these big dermatology names behind it, supporting it. And I don't know how much of a conflict of interest it is, like how much they're being paid by the company. And, just whenever I'm at the meetings and I see their booth, I don't know. I just kind of get the skeevy vibe that they're just trying to sell. And they're not just marketing it to dermatologists. They're like, going through naturopaths and all
They've
these other.
expanded their branding to be like, oh, we're like just a vitamin supplement.
That anyone can take.
And then that makes that makes you question as a consumer. Okay, well, were you always targeted towards hair, and now you're just trying to like make your buck?
Yeah.
You know?
Yeah. No, I really do think you just have to be cautious, do your due diligence. I mean, I don't think it's going to hurt.
Yeah.
But I don't think it's really going to help. You're just going to, lose a lot of money over the years. And Viviscal, similarly, I have not noticed standout results with it. And they also have marine
the algae, right? Yeah.
The marine collagen. I think it's derived from sharks, actually, their cartilage or something. But regardless, some patients are kind of skeeved out by that. So I'm not a huge fan of either. And there really aren't that many great supplements out there. There are some key ingredients that have been shown to help with hair loss that are natural. And some patients want a natural, product, derived from plants. And there has been some data, pumpkin seed oil. We've seen that NAD has been helpful, L-taurine, saw palmetto. So there is some evidence behind those. And, recently, some of the leading hair dermatologists, around the world have created a supplement called Express A, which is really interesting because it really has that proprietary blend of these antioxidants and other ingredients that have been shown to specifically help with hair nutrition, facilitate hair growth. We're not saying that these supplements are the one and only treatment. They're a good adjunct. So I've been pretty impressed with their data and what they're putting into their supplements. And the nice thing is they come as gummies and they taste pretty good.
Yeah, it also has ashwagandha in it too, which I think is huge because that could help with the stressful effects of hair loss.
And it has turmeric in it too, right? I believe.
I think so. Yeah.
Yeah. So there's a lot of benefits to it.
Anti-inflammatory.
Yeah, the other supplements I think worth mentioning, specifically if you do get your labs done and you see that you're low, is your vitamin D and your iron supplements. I know I tend to get very deficient with my vitamin D in the winter, so I'll tend just to add in like a isolated vitamin D supplement during the winter months, and then I try to check it usually once through the spring and make sure I'm not still low. But a lot of people do struggle with low vitamin D, especially our patients with skin of color who have a harder time making that.
Kind of moving forward, some treatments that you can have in offices. First one I think is pretty common is intralesional steroids. So where we're actually using steroids to inject right into those hair loss areas, and that really helps calm down some inflammation if there's any associated with that hair loss, as well as just stimulate the hair growth. this is a very common treatment for specifically alopecia areata. Also frontal fibrosing alopecia. We don't necessarily use this for like the genetic types of hair loss, like androgenetic alopecia. It really helps with those localized patches of hair loss.
Red light therapy is another treatment in the office that we utilize. So red light's great. I mean, we've talked so much about it. There's so much science and data on it. It will essentially help increase your blood flow, and that can stimulate those hair follicles. We do use it in conjunction with some of our growth factors. As mentioned earlier, the Cara factor is actually, more effective when stimulated by that red light therapy. So a lot of places now sell the caps you might see at Costco or on Amazon, the red light caps. And I think those are great at-home treatments as well as things you can do in office.
We can do nutritional supplementation through IV hydration, kind of have a blend of antioxidants and other nutrients that can help with promoting hair growth. Vitamin Bs, you can have a few other ingredients that go directly into the bloodstream and just can get throughout the entire body, improve the scalp health.
The
hair
NAD
growth.
shots that
NAD
we've
is
offered,
great,
and
yeah.
you can add as
Beta
boosters to
thione.
IV. Yeah, so many.
Yeah. Next, there's also PRP and PRF. So we've talked a lot about those as well. PRP is platelet-rich plasma. PRF is platelet-rich fibrin, which we haven't really dived into very much. So just to kind of break that down, PRP is where we actually draw your blood in the office. We spin that down in a centrifuge. It separates layers of your blood. There's a golden layer called PRP, or platelet-rich plasma. We have used that historically to actually inject in those alopecia areas to help get growth factors to the area, nutrients and vitamins to help kind of stimulate that hair growth. But PRF is showing to be more effective and less painful. So PRF, platelet-rich fibrin, that's where we actually mix PRP with calcium chloride to create that platelet-rich fibrin, and it creates this more robust, more effective result.
We've also been using energy-based devices, so such as Lay's MD, for example, with their Cara factor. You might have heard of Cara Lays. What that does is it creates these little microchannels in the scalp, and we can actually apply that growth factor solution right on top, as well as using that red light to help stimulate more growth factors in that area. So that can help just prompt those follicles to start that hair growth production again.
Got it. And then finally, we're left with our last resort, our surgical option, which is hair transplantation. So hair transplantation has been around for decades, and it has evolved dramatically over the years. And honestly, I am a big fan of the right candidate getting a hair transplant. These are for people who have pretty advanced hair loss that A, aren't either responding to therapy, or B, they want just a quicker response and really regain their hairline. So typically we take hair follicles. There's two methods: follicular unit extraction as well as follicular unit transplantation. So the original was a strip of hair, like the skin from the scalp contained the hair follicles, that was removed and surgically excised. And then that was broken down into follicular units and then transplanted into the areas of hair loss, typically like the frontal or vertex scalp. But with short hairstyles, you can see the visible scar. But those hairs that are transplanted retain the characteristics of the occipital hair, which tends not to be affected by those hormonal changes we see with androgenetic alopecia. So that's why it works. And over the years, follicular unit extraction has become much more popular, where they're actually extracting those units with small little punch devices to remove them directly from the scalp. Or so you have tiny little scars that are barely perceptible. You can't really see them. And then you're taking those follicular units and implanting them into the areas of hair loss. So a lot of patients favor that because you don't have that linear scar on the back of the scalp. Women in general tend to favor that as well because they're not shaving a large portion of their occipital scalp to get a strip. So those are options. And then we also have robots now, the Artist robot, that also can, basically do the follicular unit extractions and also do the transplantation portion of it. So pretty interesting. I do recommend it for some of our patients, but I do recommend going to a reputable surgeon to do that. It is very popular to go overseas now to get it done, specifically Turkey. And there are some great hair transplant surgeons there, like some of the best in the world. But you really need to know what you're getting into, and you're really not getting that much post-operative care. So when you deal with complications when you come back to the U.S., it's kind of hard to, be managed by your hair transplant surgeon if they're in Turkey. And we've seen that a few times, including a patient not too long ago where they had, this staph infection affecting their, recipient site, and we had to treat it so that we can minimize any losses from the hair transplantation. So, you just got to be careful. I know it's a lot cheaper, but you get what you pay for.
Another thing I've seen that's not a true treatment to hair loss, but I just thought it'd be worth mentioning, are the people doing like permanent makeup to their hairline, or like the tattooing. I was friends with this guy in high school who ended up going on to be like a barber, but now he's gotten his like tattoo license to do the hairline, and they basically just fill in with like these almost like when they do the brows, the ombre or the shadow brows, things like that, and they just fill in those areas. But then I always wonder, well, what happens if the hairline starts receding more and more, then you're just going back and touching up.
Yeah, well, that's kind of also like the issue that we had with those original plugs. And also poor design of the hairline, because you have to almost design a hair transplant or any of those, like more permanent type of, treatments. Like you're looking at a period of time, like we're looking at decades later on. So if they continue to get hair loss and you still got those plugs are still going to stay.
Yeah.
And the rest of the hair that is,
it looks odd.
it looks horrible. And it's a dead giveaway that they got plugs. It looks so unnatural.
Wrapping that up, I think there are a lot of great options for treatments, but definitely consulting with a hair professional or dermatologist to help decide what is the most effective option for you. I think it is definitely worth mentioning prevention. If you aren't experiencing hair loss, there are still ways that you can, prevent it. I think the biggest thing is nutrition. So making sure that you are getting enough vitamin D, whether that's from, we don't necessarily recommend going out and baking in the sun to get vitamin D, but taking a supplement, iron supplementation, or iron-rich foods, as well as zinc and protein intake. I think that makes a huge difference, making sure you're getting all of those essential amino acids to support the hair growth.
Also, making sure to avoid, tight hairstyles or hairstyles that might create that tension in the area. So for, females or men, those high ponytails or really tight ponytails, buns, things like that over time can create that hair loss. I always think about back when I did ballet and I always had my hair in like a tight, low bun, and just at the end of practice, my head would hurt so bad. And so I always joke maybe that's where my temporal recession is coming
that's
from.
Me too, except mine was a tight, like high pony.
Yeah.
I cannot do that anymore. I feel it immediately.
Yeah, I do too. I have like an hour cut off and I'm like, get this off.
Yeah.
Yeah.
I can't relate.
Yeah. Well, he's growing
he's
he's growing his hair out. So who knows? Maybe in a month or two, we'll see Dr. Zain with a man bun.
Just you wait and see.
Well, and that's funny because, so just some history in my personal journey with hair. So my dad is completely bald. Both of my brothers are thinning. My mother also has hair loss and thinning. So I've always been deathly afraid of losing my hair because, it's just something that, I always liked having. And actually, one of the reasons why my wife married me, she liked my hair. So, there's nothing wrong with taking some preventative measures as well. So, you can go as far as, some of these treatments prophylactically. So I've done PRP before. I've done the Carolase treatment with growth factors. I take the nutritional supplements. I take Extra Say every day. I do red light therapy. I think that helps. I'm not really taking oral medications right now. I'd save that for when I actually do need it. Hopefully I won't need it. Other than that, I mean, there's nothing wrong with, taking some of those measures into your own hands. Like, there's nothing harmful with those. And then, if I need to take medications later on, I will. But until then, I'm going to do whatever I can to keep my hair.
Yeah. I think lastly, with prevention, managing stress plays a huge role. And there are some things that you can't really manage very well. Like if there's a necessary surgery, or like if you're pregnant and you're going to go through childbirth, those are very stressful events that in order to deliver the baby, you have to go through that delivery. So, trying to manage stress where you can play a big difference in the treatment.
Yeah. I mean, Heather's mom's a yoga instructor. We should all join her
Do
classes.
yoga.
Yeah, do your meditate, all the good stuff. So the earlier you start treatment, the better your results will be. You definitely don't want to wait until, you've got that, what do they call, like the crowd, the U, or you just have the hair ring. And you're like, let's try to add back hair. At the first sign of thinning, I think it's always a good idea to get a professional opinion on what's going on, because again, there could be underlying issues, and the faster you're able to correctly diagnose, the faster you'll be able to treat, and the more hair you'll be able to retain.
Yeah, and I think it's good to keep in mind that these are not going to be very quick turnaround treatments. I mean, you do have to be a little consistent in the beginning and be a little patient. Yes, there are some treatments that are going to give you quicker results than others, but if you're patient and you're willing to go through that waiting process, it's going to make up for it.
Yeah, and if you're struggling with hair loss, or your loved ones are struggling with hair loss, you should know that there are options, and we are here to help. It's a judgment-free zone. We're going to do whatever we can from a medical standpoint to help you reach your goals. But just remember, you don't have to give up hope. You don't have to shave your head. Although some people look awesome with shaved heads, I have no problem with that. But if it's something that's bothering you, we can try to help. And, I know that a lot of people are often suffering in silence, and they just wait. And, unfortunately, when you get to advanced stages, you really can't do too much. So early intervention, like Courtney had mentioned, is key for the optimal results. So I do think that if you do act, we can probably help you. This wraps up our second episode on hair loss. I think that there are a lot of treatment options that we did not have available decades ago, so we're lucky in that sense. And then constant innovation, hopefully will yield new treatments, so that'll be exciting. So hopefully you liked this episode. Please subscribe and share with a friend. And until next time, Skinside Out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.